All right, so this is the appearance of a standard laceration kit. The design may vary just a little bit, but many of these are going to come in a plastic bag. So before you discount this bag, I want you to think about is the fact that this can be used as a trash receptacle. So everything that you use, everything after it's done, you can simply put all of this into this plastic bag and throw it away. So we're going to put this off to the side here. So all the kits, for the most part, at least in my experience, come wrapped in some way, shape, or form. So you can almost act as if it's like Christmas. You can unwrap your laceration kit and voila, the contents inside. This particular one, everything comes in a plastic basin. So what I typically do is the kit will be sitting on a mayo stand or a bedside table. I go in, I open everything up, and I usually just plop it all out, just like that. So this basin right here, the primary purpose of this is to hold saline or tap water that you're going to be using for irrigation. Sometimes I may put the instruments in there, fill it up with tap water. You can use it to hold your suture thread as well. But for the most part, this is to hold your irrigation fluid. So placing that off to the side here. Now we're going to go through all the different components. First off is your syringe. The syringe, the primary purpose of this is to load with lidocaine, whatever anesthetic you're going to be using. So that is a syringe, pretty straightforward. Next we have these two little medicine cups. Quite honestly, in my experience, I find these to not be very helpful. Sometimes if nursing staff or a tech may set everything up for you, you may walk into a room and one of them's filled with betadine, the other's filled with saline. First of all, this only holds, let's see here, 50, 60 cc's. That's not enough to irrigate a wound. Maybe you can dip a gauze down into it and use it for wiping the wound off. With betadine, quite honestly, I find that just to be kind of cumbersome. And for some reason, whenever these things are filled with betadine, they're more likely to spill, in my experience. So personally, I don't find these to be very useful. I don't use them. Some people do. Next, we have a handful of needles. For the most part, you're going to find an 18 gauge needle that's used for drawing up your anesthetic into the syringe, and then maybe one or two extra needles of varying gauges and lengths. These here in particular, this is a 27 gauge half-inch needle. This is what I typically use for injecting anesthetic into a wound, or if I'm using this for an abscess, incision, and drainage. This here is a 30 gauge 1-inch needle, and I find this one a little bit more difficult to push anesthetic through. So for the most part, I'm using the 18 gauge needle and the 27 gauge needle. Next, you can see a variety of gauze. 4x4 and some 2x2 gauze. Most of the time, whenever I'm getting set up for a laceration, I'm going to bring an extra little boat of 4x4 gauze. I find them to be very helpful, and I'd rather have a little bit too much. You don't have to necessarily open them, but it's nice to have plenty of gauze that you can have available for you in case the wound is bleeding excessively and whatnot. So it's always good to have plenty of gauze available to you. Different kits are going to have differing amounts, but this is a fairly thick stack here, so that for the most part is going to do quite well. Now we also have an assortment of drapes. Different manufacturers have different drapes within their kits. This you've probably seen before, and this is a drape that is used to provide a little bit of a sterile field. Actually, it seems like this one has, this one's, there we go. All right, so this one's gonna have a hole in the middle of it. What you can do is after you've anesthetized and irrigated the wound, you can put this down with your laceration here in the middle. If you got a very large laceration, this obviously is not gonna be big enough. I personally don't use this that often because I find that this sometimes gets stuck in the wound, it gets wet, and I find it just to be a little bit cumbersome and quite honestly unnecessary in my experience. I feel comfortable not using one of these. Some people like them because it seems to kind of expand the sterile field, or at least a very clean field. You know, you can use this, you can try it with or without, see what you're most comfortable with, but that's what that drape is for. All right, then we also have a couple of just large drapes. This is what I typically use. So, you know, in this particular kit, there's 2 of them. Let's say your laceration is right here in the middle. You may want to put one right here. You can take a second one, kind of angle it off to the side in some way, shape or form. I usually use these as a place to hold my instruments whenever I'm repairing the laceration. You don't want to put your instruments or gauze or anything else onto the patient or something that's not clean or sterile. So using these drapes in close proximity to the wound, I think is kind of a good launching pad, so to speak, for a place to hold your instruments when you're repairing the laceration. So different kits are going to have different components when it comes to these different drapes, but that's what they're for, and that's what I typically use them for. All right, so lastly and most importantly, we're coming to the actual laceration kit instruments. In my experience, having used a large number of different manufacturers' kits, all of these are going to come with 4 standard instruments. We've already talked about instruments, what they are, what they're used for, but we're just going to kind of go through these again. And I'm going to go in an order of kind of least important to most important. Least important is probably your hemostat. From a laceration repair standpoint, you really don't use this that much. You may use it from time to time if you've got a bleeding blood vessel. You can actually use it to clamp off the blood vessel. I typically use these when I'm doing an abscess, incision, and drainage. After you make your incision, you can use these to insert into the abscess cavity, spread open, to be able to open up any loculations. That's the main thing that I typically use the hemostats for. You can also use these to remove staples if you don't have a staple remover with you. But that's the hemostat. I'm going to put that off to the side here. Next we have the tissue forceps. Now, tissue forceps can come in differing styles. Some may be flat, some may have little ridges on the inside of them. These particular ones have kind of like a tooth and groove type of a setup. Now, one thing that you want to be careful with is not using too much force whenever you're manipulating the tissue or lifting the tissue up. What these are important for is to be able to manipulate the tissue, and you can use this to expose the tissue for your needle driver, which we'll talk about more in a second. But sometimes you may need to stabilize the tissue so that you can introduce the needle through it. So tissue forceps are very important. Again, very important not to put too much pressure on the tissue when you're using them. Scissors. Now these are called suture scissors, and these are very important. They need to be sharp. It's kind of painful when you're trying to cut suture thread and your scissors are not sharp enough to cut the thread. So it is important to have good quality instruments. The other thing that you can use these for is for the debridement of little jagged edges of tissue. You can also use them when you're undermining tissue. You've got a wound that's got a lot of tension, and you can use your scissors to kind of insert them in between the epidermis and the dermis to undermine, kind of open things up, kind of like a sharp dissection. So having good quality sharp scissors is very important. The last and the most important instrument is the needle driver. Now, needle drivers may come in varying lengths, varying quality. Most important reason that you have a needle driver is to hold the needle. And in various places that you may work, the quality of this particular instrument may vary, but what you really need to look for is an instrument, a needle driver, that's going to be able to grip and grasp the needle as you introduce it through the skin. Now you can see here these little grooves that are on the end here near the loops. So what you can do is, if you need to grasp your needle, you can actually apply a little bit more pressure, and those are going to grip so that you can let go and you can still hold on to the needle. And then as you're holding these, I typically hold them with my thumb and my middle finger, sometimes even with the ring finger. And what you can do is you can have your index finger to be able to help, kind of guide them and direct the needle into the skin. So you're going to be holding these like that. You can grip down, and then you're not having to continually squeeze. So the needle driver is used to hold the needle as it is being introduced into the skin and through the skin. Now, after the needle comes through the skin, either on the first pass through or the second pass through, you really want to be able to start use early on in your experience, in your clinical training. Really try to make this a two-handed technique. You really don't want to start grabbing the needle with your fingers because you're going to get stuck with a needle. So the earlier that you can start with proper technique, proper technique is very important. So you're going to introduce the needle through the skin, and you really want to start using your needle, the tissue forceps to grab the needle, help bring it through, and then you can grab the needle again for your next pass. So needle driver, very important instrument. And the other issue that you can sometimes run into with the needle driver is after you're tying your instrument knot, sometimes the thread, we typically see it more with very fine thread like 6-0-proline, will sometimes get caught in the hinge right here. So whenever you're tying your first surgeon's knot, you're bringing it across, you're tying the thread across, sometimes it gets stuck in the hinge. So that's another issue that you may run into. So important to have good quality instruments whenever you're repairing lacerations.